Platelet-rich plasma is a method of extracting your own body's growth factors out of your blood with a special centrifuge that can be used in the office, and injecting that back into the body to be used to promote healing in certain areas. It's traditionally been used mostly in the orthopedic world for joints and other orthopedic injuries as a regenerative growth mechanism, but more and more has been able to be used in other areas of medicine, including for problems with the skin, for hair regrowth, and now even for gynecologic indications. So I've started providing vaginal PRP in our practice because I have found it to be a very powerful intervention outside of just using surgeries and other hormones for some concerns that women don't love to talk about. Those things, namely being urinary incontinence and sexual dysfunction. I love helping people with those problems. It's definitely something I love helping people to feel comfortable about, talk about, and really feel like it's important. As women, those are two things that we just tend to try to brush under the rug, accept as a normal that we should just deal with and kind of put up with it. I see that time and time and again in talking with so many women every day. But it's actually a really, really important thing to address. So definitely can use both systemic and vaginal hormone therapies for many people, and that can be helpful, but again, it can be incomplete. And what we have learned and what we're seeing is that PRP can be used vaginally to help with both urinary incontinence and sexual dysfunction for certain subtypes of people. One area that it's really fabulous is for people who can't use hormones. So for example, breast cancer is pretty common. We all know that 1 out of 8 or 10 women will be diagnosed with breast cancer in their lives. And unfortunately, the age seems to be getting younger and younger. So many women are getting breast cancer treatments before they've reached menopause age, in their late 30s and early 40s. And that treatment will then lead them to go through premature menopause, and they will suffer all of those side effects, essentially, of menopause at a much younger age, and then not be able to use conventional hormone replacement options. So that's a very powerful place that PRP can come into play and help to restore vaginal lubrication and ability to even have intercourse where sometimes it becomes almost impossible. One of my greatest victories, and one of the first people I helped with PRP vaginally, when she came back in and she said, it goes in like it used to. And I said, that's the best thing you could have ever said. So a lot of patients that come in for vaginal PRP come in nervous, thinking it's going to be uncomfortable. They have all their armor on and they're worried. And we get finished and they say, oh, that was no big deal at all. So it's not something to be afraid of. It's not a painful experience. People come in, we draw the blood, we spin it in a special centrifuge to extract the platelet-rich plasma. We activate it with some special little syringes. We numb everything up. We do the injection. The injection part takes about 5 or 7 minutes, and then you go home. And it's really not that big of a deal, and it does its magic over the next 4 to 6 weeks.